Hello. This education module, Agitation and Dementia, represents one module in the online education series, Dementia and Neuropsychiatric Syndromes, designated especially for formal and informal caregivers who are providing care for persons living with dementia. We want to welcome you, and we are going to use the term persons living with dementia throughout the module to emphasize that dementia is a diagnosis and does not define the individual. Dementia is a highly stigmatized disease process. The term person living with dementia is used to promote positive language and a more person-centered approach. Almost all persons living with dementia will experience neuropsychiatric symptoms. Persons living with dementia commonly experience agitation. Agitation is a subjective term and is often communicated inappropriately by caregivers and healthcare professionals. Caregivers are generally the ones that observe the agitated behavior and then describe the characteristics to the healthcare professional. Agitation is common in dementia and affects many persons living with dementia at some point in their illness. Agitation is about being restless, anxious, and even nervous. Agitation may be accompanied by inappropriate verbal, vocal, or motor activity, such as pacing or wandering. What is agitation? A behavioral disturbance was one term that was used to describe neuropsychiatric symptoms. So if you encounter the term behavioral disturbance, this means that your loved one may have depression, anxiety, psychosis, agitation, or another characteristic. Behavioral disturbance is a broad term that can include symptoms of agitation. Agitation is a term that is often used to describe one aspect of behavioral and psychological symptoms of dementia. A definition of agitation is behaviors that communicate to others that the person with dementia is experiencing an unpleasant state of excitement and are unrelated to known physical needs of the person that can be remedied and are without known motivational intent. The definition recognizes that behavioral expressions are a form of communication of distress. These experiences are symptoms of a disease process that is not within control of the person living with dementia. What are symptoms of agitation? Persons living with dementia can get anxious or easily upset. They might have angry outbursts, disruptive or impulsive behavior, excessive talking or movement, difficulty sitting still, pacing or shuffling of the feet, tension, anxiety, and irritability. They may be unable to sleep. These behaviors are referred to as agitation. Something is causing the individual to be agitated. Since every person living with dementia is a unique individual, the way they express agitation is unique to that individual you are caring for. Agitation can keep the individual from their normal day and night routine and might become harmful for your loved one or you or their caregiver. So how do you recognize symptoms of agitation? Agitation is related to more than one symptom generally. The possible underlying cause or causes for agitation may be due to hallucinations, delusions, anxiety, or depression. Clear communication about symptoms of agitation between healthcare professionals and persons living with dementia is very important. If your loved one experiences symptoms of agitation, It is important to be specific when communicating these symptoms. Recognize how delusions, hallucinations, anxiety, or depression may play a role. Pain or constipation are also an important trigger for agitation. Think about, is there a pattern for the symptoms? Consider if the symptoms are abrupt or gradual. The time of day or night is also very important. When do these occur? If you can't determine what the underlying problem is, you might want to take the person living with dementia to see their healthcare provider. Are symptoms of agitation serious? Well, sometimes agitation may be due to an underlying physical cause that may or may not be serious. Sometimes agitation can indicate a delirium that is due to an infection or even a new medication. They're very common in dementia and affect up to 90% of people living with dementia. In addition to memory changes, people living with dementia may experience agitation. A urinary tract infection is a common cause of symptoms of agitation. Medication side effects may also be implicated. Pain, constipation, when they're not getting enough sleep, heart failure, changes in the home environment, changes in caregivers, grief and loss, mental health, and loneliness are only a few of the considerations that you and healthcare professionals need to think about before arriving at a diagnosis. Some of these conditions I just stated can be reversed, or something can be done about them. However, agitation may be a signal of progression of the disease process. Delirium is particularly caused by acute illness or drug toxicity and is often reversible. Depression can also be treated. So what should you do next? You may be able to decrease or stop the agitation by simplifying the person's routine or distracting them from the stress that caused the problem. A few things that you might include are creating a calm place for them, cut out background noise such as from the TV or radio, clear away clutter around the person, and make their daily tasks as simple as possible. Check for physical reasons they might be agitated, like are they hungry, thirsty, are they needing to use the bathroom, or are they too hot or too cold? For persons living with dementia, prevention is the first line consideration in the treatment and management of neuropsychiatric symptoms. Report any symptoms of agitation to your healthcare provider. Non-pharmacologic interventions are first-line treatment. Early treatment of underlying causes of agitation can actually prevent neuropsychiatric syndromes. Physical activity is known as an effective intervention, even if only walking to the table for meals. Cognitive behavioral therapy, as well as music, presence with a video or audio tapings from families, aromatherapy, or pet therapy can be utilized. So, what else can we do besides what we just talked about? For persons living with dementia, they might like to dance. They might enjoy lower lighting or night lights in their dark room at night. Shadows can sometimes cause them to think that there are other people around, or even more difficult things like animals. These are where hallucinations come into place. We also need to be important to understand that this is a brain disease. This is not personal to you from the person living with dementia. So try to hold in your emotions. Try to speak to them in a calm voice, and definitely no arguing or criticizing. This will just cause them to become more agitated. So drugs can cause side effects like drowsiness, rigidity, and unusual movements. Research has linked some of these medications to a higher risk of death for people living with dementia. The FDA has placed what we call a black box warning on some of the drugs that are prescribed to take care of agitation. Recognizing the underlying cause provides more options and avoids unnecessary hospitalizations as well as medications that the individual does not need. So in summary, neuropsychiatric symptoms of agitation are common in persons living with dementia. Symptoms of agitation present atypically, especially when persons living with dementia may not verbally express emotional distress. There are many overlapping symptoms of chronic illness and dementia that may overshadow neuropsychiatric symptoms. Agitation, or terms such as aggression or behaviors, are associated with stigma and have a negative indication that persons living with dementia can control these symptoms in some way. Recognizing and communicating these terms as symptoms decreases stigma and expedites early detection, treatment, and management of neuropsychiatric symptoms, with the overall goal to improve quality of life for both persons living with dementia and caregivers. Caregivers who want to know more about neuropsychiatric symptoms of dementia are encouraged to participate in the Dementia and Neuropsychiatric Syndrome series. Thank you very much for your time.